welcome everybody to this webinar, which is designed to launch our latest piece of guidance, enabling climate and health resilience, a blueprint for urgent business action. I think the next slide is the agenda, if I'm not much mistaken, in terms of what you can find, what you can expect today. I'm Sally Uren. I'm here in my capacity of co-director of the Climate and Health Coalition, and I'll share a little bit about the work of the coalition in a moment. But the essence of this conversation today is to take you through the findings of the report. And then we've got three amazing panelists who are going to bring the report to life, bringing their own experience on this agenda. And then there'll be an opportunity for Q&A with the panelists at the end. If you have questions as we're moving through, please put them in the chat. There will be an opportunity, though, for questions at the very end. If also you wouldn't mind introducing yourself in the chat by sharing your name, your location, your organisation, and if you can, what you're hoping to learn. But at the very least, if you wouldn't mind just saying hello, it'd be really great to understand who is on the call. I'm joined today by three forum team members, Christina, Clara and Ksenia. You'll see them at various parts of your screen, and I'll introduce the panelists when we get to that point in time. So I think what I just need to do before I hand over to Ksenia to tell you about this really great report is explain a little bit about the Climate and Health Coalition, which is this wonderful array of organisations here. The Climate and Health Coalition is in its fourth year, and it sprang out of some work that we originally, as Forum, undertook with the United Nations Global Compact back in 2018, when it became really clear that anything an organisation does in the private sector to decarbonise, to build climate adaptation plans has also got a health benefit, and climate and health are two sides of the same coin, and that if we could make a case for integrating climate and health, we could perhaps accelerate private sector action on climate and health. And that was the genesis of the coalition. Our initial four partners include Haleon, and Sarah is here with us today. And what we've been trying to do through the coalition is make the case for thinking about climate and health as two interrelated issues. We've used examples from the food sector, air quality, malaria. These are all issues that really bring into sharp relief the intersectionality of climate and health. And then we've been producing guidance documents. The overall ambition of the coalition is to unlock private sector action at the intersection of climate and health. And we take a systemic view. We understand that health is not just a function of access to healthcare, it's a function of the food that we eat, where we live. And we've been really thrilled to be able to grow the coalition from the original four healthcare organisations involving broader healthcare actors, as well as actors outside of healthcare, from the food system, from global packaging, and also Train Technologies, who are very active in the built environment sector. We also really, as a coalition, want to try and join up this burgeoning activity in the climate and health ecosystem. And we have now nearly 20 associate partners. One of them is Healthcare Without Harm, and we have Emmy from Healthcare Without Harm with us today. And we're really deliberately trying to create the space in the system where the private sector can engage with each other, but across the system, and facilitate that connectivity across all of this amazing work that's happening in climate and health. And as I mentioned, one of our key levers of change is producing guidance documents. And today's webinar is really shining a light on the latest episode in that guidance documents. And I think I'm going to hand to Ksenia to really tell us what we've discovered through the latest guidance document, and then we'll open up the panel discussion to bring it to life. Ksenia, over to you.
Thank you, Sally, and hello, everyone. It's so great to see you today, and thanks so much for being here today. My name is Ksenia Benifend, and I'm one of the lead authors for this research and report, together with Clara Hessler and Natasha Medek, who are both on this call. And I'm excited to share more about this work. So this is a topic that's really relevant right now. And so I'm hoping that today's webinar sparks some reflection and maybe some new ideas for how we can move boldly and collaboratively in this space. So I'll be sharing high-level overview of the report, including some of the insights that really stood out to me throughout the research. So let's start with the shared language. When people talk about climate change, sometimes we talk about big visible events, melting glaciers, floods, wildfires, but we don't often talk, or not enough, about what it's doing to our health. So as temperatures rise, so do cases of respiratory illness, heat stroke, waterborne diseases, and mental health. And not everyone is equally exposed or equally protected. One of the reasons we did this research was because we kept hearing that there is lack of understanding at the intersection of climate and health equity. And without clarity on what these terms really mean, how they show up, what they look like in practice and in real life, it was hard for businesses, policymakers, and communities to align and to act with intention. And that's why it was really important for us to start here. So as you can see in this visual, we are looking at health equity and climate resilience. So health equity means ensuring positive health outcomes for all. Everyone has a fair and a just opportunity to be as healthy as possible. And it's not just about healthcare, it's beyond. It's social, economic, and environmental conditions that shape health. And so this report shows and goes into the specifics of what that looks like. And then climate resilience is the capacity of individuals, communities, and systems to withstand, adapt to, and recover for climate disruptions and environmental hazards. So when we're talking about climate and health equity, we're referring to the ability of people and communities, especially those already vulnerable, to navigate climate shocks without deepening existing health disparities. So you could see in this image the overlaps that we discovered. And health is not personal, it's collective. So your health depends on your environment, your infrastructure, your access to clean air, water, housing, and care. So I would like to, if we can go to the next slide, please, Clara. So this is an animation that we put together to help to bring this to life. And here you could see personal traits at the intersection of health and climate action is recognition that health is shaped by a variety of factors. And then you could start seeing here how they intersect, and that our individual health is created or eroded by multiple environmental and social factors, which can often interact to create unique health experiences and challenges. And so, for example, lack of green space or air conditioning in your environment can increase your health risk during a heat wave, and this may be compounded. And so we provide different examples, and the purpose of this is to be able to take some time and reflect and really think about the impact. So I'd love to take just a moment to reflect and really think about where your experience is on this wheel. So think about your personal traits and how they're perceived in society, your social and economic condition. Do you have stable housing, financial security, healthcare access? And then your environmental conditions. Is there clean air where you live? Do you have green space access or access to fresh food and clean water? And this is helpful. This is a visual way, and it's helpful to think about yourself, where you live, your community, people who work with you or for you, your suppliers, your customers, and the community where you are operating. And it really helps to think about the dimensions that shape how climate change affects us, not just physically, but emotionally, economically, and even generationally. So while this language around it may seem technical, we're hoping to bring this to life when you think about real lives and real experiences and opportunities to show how we can act together. Next slide, please, Clara. Okay, great, thank you. So now that we've grounded ourselves in the definitions and reflected on how climate and health equity shows up in our lives, let's go into why this matters to business. So part of the purpose of this report was to provide the definitions, to explain what it looks like, but then go into the so what, now what? What does that mean for business, and what can businesses do to start activating in the space? And why? So what is the business case for taking action? And for this, we've we've looked at multiple reports that are already out there and pulled out some key insights, and also pulled out key insights from the interviews that we did. And first, the business continuity is at risk. So climate disasters like wildfires, floods, extreme heat are no longer rare. We know that they're starting to become routine, and they're directly impacting supply chains, infrastructure, and workforce health. And when a key manufacturing site is flooded or power is lost during a heat wave, for instance, production halts, deliveries are delayed, employees may not be able to come to work safely. This is a statistic. So in the report, would provide multiple data points, but here's the statistics that really personally shocked me when I was looking at it, and I had to kind of go through it a couple of times. So this is from 2024 Lancet Countdown report, shows that heat exposure in 2023 led to global loss of 512 billion possible labor hours. And I actually had to go in and figure out what that means. And that's equivalent to 260 million people losing their jobs in a year, which is astounding. It's a staggering loss of productivity and income, which they estimate at around $835 billion globally, which is about a 50% increase over 1990s average. So it's not, this kind of disruption is accelerating. So the second point is community resilience is business resilience. And so this example that I just provided, it doesn't fall evenly. It disproportionately impacts low and middle income countries where labor-intensive industries are more common and protections against extreme heat are often lacking. So when communities struggle due to poor infrastructure, limited healthcare access, or compounding climate impacts, the ripple impacts businesses directly. Employees are not able to show up, healthcare systems are strained, customer bases become more vulnerable. And another example where we just recently saw this was during Hurricane Helene, when flooding shut down Baxter's facility in North Carolina, which is one of the largest producers of IV fluids in the US. They produce about 60% of the IV fluids, and that single disruption cascaded effects across the healthcare system, delaying patient care across the country. So this is just a reminder, businesses are not operating in isolation. They really rise and fall with communities and the environments, the play space they depend on. Third, integrated action beats limited in impact, and businesses that integrate climate resilience and health outcomes together are better equipped to reduce risk and unlock innovation. And then finally, leadership today defines resilience tomorrow. So companies that are acting now are reducing risk, building continuity, resilience, social license to operate. Because we are in a world shaped by disruption, climate resilience is becoming a competitive advantage. The next slide, Clara, please. So, we've laid out the definitions and the case for actions. So now what are some of the strategies for taking actions? And here's a few that we've pulled out. And again, in the report, we go into all of these different strategies in a way that's comprehensive. We provide different tools, frameworks that you can access and you can follow through. But some of the ones that really stood out was around understanding place-based impacts, just the importance of really being able to map your operations and how they intersect with environmental and social vulnerabilities. We've shared different tools that you can start using to help you map and identify place-based interventions that could have the biggest impact. Second is around collaborative and inclusive partnership. There's a need for partnerships even more urgently today than ever. And partnering with local governments, community-based organizations, public health leaders, really to ensure that business efforts reflect lived realities and are building long-term trust. Building internal capacity and governance. This came across so many different things. Without internal alignment, none of this work is really possible. And this means embedding these priorities into corporate strategy, risk frameworks, employee education, performance metrics, and ensuring that they're not siloed. And to pause and say that language matters right now, a lot of this work and language is politicized. And so finding specific ways to talk about these issues that are aligned to organizational values, such as worker safety, and health, building supply chain resilience, energy security, and thinking of a language that's not politicized and can actually get traction is really critical. Embedding climate and health equity into supply chains. So we know that supply chains are a major pressure point, and that climate impacts often concentrate where labor is most vulnerable. So we have a whole section around really thinking through supply chains. We also launched a toolkit last year that links in the report that you can actually go through and analyze your supply chain from that perspective. Health literacy and education is also really, really critical, has come up quite a lot, and is a really critical lever of change, equipping employees, suppliers, communities with knowledge and tools, especially as we're getting into this world with more extreme heat and extreme events. Building awareness and preparedness of really resilience. And finally, to track what matters. So this is an opportunity to really think about measurements that the outcomes that connect climate to health. So things like reduced absenteeism or better indoor air quality or access to cooling. So really looking at metrics through that lens. Next slide. So I know I've kind of given you a tour of the report. And like I said, there's a lot more. There's resources and different links that you can go through and case studies. This is where you can download the report. And just to quickly, and this you can download this on your phone if you want to, and then we can also share a link in the chat. Some of the next steps, and Clara, if you can go to the next slide. We would love to learn from you. So if you are doing if you're doing work in this space, we'd love to hear your case study and share your case study, because this is a great way for us to all learn from one another. Also, we'd love to continue to share this work and this report. So if you know of any other venues, conferences, coalitions, industry groups where this research should be presented, let us know. We do want to keep this dialogue going. And stay connected with us by signing up to the Climate and Health newsletter. And then we'll share all these links at the end. And with that, thank you. I'm excited to hand it over back to Sally to introduce our incredible panel of speakers. And I will be here. I haven't checked the chat yet, but I'm happy to respond to questions over the chat, or at the end, we'll have a Q&A for all the questions. Over to you, Sally.
Thank you, Ksenia. So yes, we're going to have a conversation now and bring some of the themes that we cover in the report to life. And I'm going to ask each of our wonderful panelists just to come off mute and to say hello while their names are still up here, and then we'll get rid of the slides and have a conversation. So I'll just ask you to come off mute in the order that you're shown here. So Emily, would you mind saying hello and introducing yourself?
Sure. Hi, everybody. It's wonderful to be here with you. My name is Emily, or Emmy Mediate, and I am the Chief Program Officer at Healthcare Without Harm and Practice Green Health. You probably already have my professional bio, or you can look me up on LinkedIn. I won't regale you with my full background and biography. I do want to share just one piece of information that helps explain how I came to this work and how I approach this work. And that is that at my core, I'm a public health professional. I actually have a deep fear of needles and getting my blood drawn. And I began working in public health because I was studying to be a doctor. I went to observe a procedure and I completely fainted. I said, this clinical route with this much bodily fluids is not for me. So I've had a winding and wonderful career journey in public health that has led me to Healthcare Without Harm, where we're working towards a vision of healthy people on a healthy planet. And we've spent nearly 3 decades innovating, piloting, and implementing solutions and partnerships in the healthcare sector to activate all of that sector's assets, its economic, political, moral, clinical influence in service of environmental health and justice. And part of the reason I'm so excited to be part of this report launch is that it is clear that this intersection of climate and health is no longer optional for businesses and no longer just in the healthcare sector. It is a strategic and financial imperative of businesses of all kinds. And we specifically work with those businesses in the healthcare sector. So with that, I just want to thank the Forum for the Future for bringing us together, for publishing this important report, and I'm looking forward to discussing more with you, Sally, and with the rest of the panelists.
Thank you, Emmy. Robyn, would you mind coming off mute and introducing yourself, please?
Sure. Good afternoon. I am Robyn Bussey, and I serve as the Just Health Director at the Partnership for Southern Equity. I am in Atlanta, Georgia. And the Partnership for Southern Equity is an Atlanta-based racial equity nonprofit where we work to advance policy and institutional action and share prosperity for all in the American South, and working also in the global South via equity ecosystem that includes health, climate and energy, economic inclusion, equitable growth and development, and youth power building. And in health, we work on a lot of issues, particularly climate and health. We also work on access because we are in the South, and we realize that folks, particularly folks in rural communities, still need access to health and social services. And also we work on focus on reproductive justice. So really glad to be here with you all. I also have a story about being on my way to be a doctor, but it was not blood, but it was organic chemistry that stumped me. So I'll be glad to share that with you all one day. Super glad to be here with you all and talk more about climate and health. So glad to be here with you all today.
Great. Thank you. Sarah.
Hi, everyone. Great to be here. I'm Sarah Mcdonald. I head up sustainability for Haleon. So Haleon is a big consumer healthcare company. We have a purpose of delivering better everyday health with humanity, and we basically exist to help support people in achieving better everyday health. And we're particularly focused from a social impact point of view on health inclusivity. So the whole climate and health equity agenda is very close to our hearts, because we have a goal to help millions of people be better included in everyday health. I'm conscious that Haleon is a new company, so you may not know the company name yet, but you may know some of the brands that we have that are trusted and lots of people use around the world to help them look after their health. So it's brands in oral care like Sensodyne, in pain relief like Advil and Panadol, in vitamins and supplements, so brands like Centrum. And then we also have digestive health brands like Tums, and brands that help you look after your skin health like Fenistil. So maybe you know us through our product brands, even if you haven't heard of the company name yet. But great to be here today and looking forward to the panel. Great,
thank you. So I think we can stop sharing the screen so we can see our lovely panelists, if that's all right. So I've just got a few questions I'd like to ask the three of you, and then, as we said at the beginning, would love to take any questions from the broader folk on the call. I'm going to start with you, Robyn, if I may, and a really simple question that gets to the heart of why we're discussing what we're discussing today, which is, can you tell us a bit more about the actual impacts of climate and health on communities, please? Ground us in that lived reality, if you wouldn't mind.
Sure. So there's so many, but I'll start and just say that climate events and climate just tends to exacerbate persistent poor health outcomes and environmental harms, particularly for communities that are already, just undergoing so much. So if you're a community that's going through a cold, if there's a climate event, you're going to experience the flu, if you want to use that metaphor. So in particular, for the communities that I work in, particularly in South Atlanta, there's a community that whenever it rains, it's almost always going to flood. So these are communities that have been historically disinvested in, communities that were historically redlined. That's probably a conversation for another day. So these are communities where there are residents who've lived in these homes for forever. These homes have not been weatherized, so they're not equipped for the rain. They're not equipped for extreme heat, for extreme cold. So whenever there's a climate event, it's going to exacerbate mold that might already be there. If it's too hot, they're not going to be able to withstand the extreme heat because they might not have, let's say, the air conditioning unit that they need to be able to efficiently cool their homes. So if they're, homes that are people who are living there who say have consistent or chronic health issues, they're already going to be made worse. So those are some of the issues that you're going to see that are going to be made worse by climate events. But also there's the community-wide issue. If there's an event, say like hurricanes, we talked about those, that was mentioned in the reports. Some of these people cannot evacuate. So that's the first thing we hear. If there's a major climate event, the first thing folks say, we need you to evacuate. But if there's a low-income community, there's nowhere for these folks to go, or no way for folks to evacuate. So then folks cannot do that. So they're living with the mental distress of, I can't evacuate. What do I do? So, we have to think about the physical distress along with the mental distress from these climate events. And then also, say again, I think about Hurricane Helene because we're in Georgia. So if you know anything about Georgia, there's Atlanta, and then there's the rest of Georgia. We have 159 counties. So probably about 20 or so of those are considered urban and the rest are rural. So when we have an event like hurricanes, and we're going to experience more of those because of climate change, most of these counties were without power for at least a week. So there's really nowhere for these folks to evacuate to. For my family, most of my family was in South Georgia, so they had to come here. They were able to come here, which is about a 240-mile trip. So some folks couldn't make that trip. So if you can't make that trip, then you're in a home that is hot. There's nowhere for you to go. Your food is spoiled. What are you going to do if you're in a place where you have a person who's sick? What are you going to do with that sick family member? So just think about that compounded upon all these other things that you're having to go through. So that's just a small snippet of how climate events can really just make things worse if you have a chronic illness, if you have mental illness. So it not only affects your physical mental health, it affects your social health. So these are just kind of some examples of how climate makes things worse in one particular community. So if you think about, communities like North Carolina, I think that were mentioned earlier, and think about places where, it may be totally different. You might have a mountainous community. So that has a totally different geographical issue. So there might be other health conditions that, those particular communities might be experiencing. You might have homes that might be overburdened from energy use. So we think about, not even extreme climate event, but if you think about things like extreme heat where we work, things that we work on like that, some families are having to really think about, can I pay my energy bill or can I pay for medicine? Can I pay for food? So those are types of things that really affect communities' health in general. So again, not thinking about health when we talk about health care, we're thinking about health and those social drivers and social impacts of health. So those are just a couple of ways of, how climate events can really exacerbate health in the social sense.
Thank you, Robyn. And a really sort of sobering tale of cascading and compounding impacts on social, mental, and physical health. So that's sort of the challenge that we're talking about today. If then we think about the role of business to respond to this challenge, in your view, what should businesses consider when they want to act on climate and health equity? What would you like to see businesses do?
First, I think businesses need to realize that they are actually a part of communities. They are members of communities, so it's not separate and apart. Businesses are a part of communities in many ways. They are employers, so a lot of the people that they employ are actually community residents. Business owners are part of communities. Their consumers, their end users are the folks in communities. So they are integral parts of communities as well as, being kind of a part, businesses in the communities. And in a lot of cases like healthcare, universities and such, they are anchor institutions in communities. So you can't think of, they can't think of themselves as being separate and apart. The first thing to consider, they actually are a part of communities. So therefore, they need to consider like how can they actually, make community be a partner in these things? How can, they work to make the community they're a part of be better? So how can I make my community better? Not how can I make this community be better? So how can we do, joint decision making, joint code, designing and better solutions. So I think really considering that, thinking of it that way, I think is really the way to go when you're thinking about how can we, together make our community better, as opposed to how can I be, how can this solution be different for, a different entity? How can we share the solution, I guess?
And have you seen any organization in particular doing this well?
I've seen it probably in the healthcare sector, in different healthcare sectors. I'll say in my community, Grady healthcare system is our safety net health system. I've seen them probably do it
Okay.
better. That's probably the best example I can give. Um, I don't know that I've seen it done as well in the South as I've seen other examples probably throughout the country. But yeah, I'd say the best example I've seen is probably Grady, the most immediate.
Great. And Emmy, I'll come to you with a similar question as well in terms of examples. Thank you, Robyn. Then my final question to you is linked to one of the recommendations in the report, which Ksenia touched on, which is this opportunity to equip employees, providers, communities, with skills and knowledge. And I'm just curious from your point of view, what's needed to educate communities further on climate and health equity? How might we go about sort of approaching that sort of knowledge transfer and capability building?
First, again, I think it's important to have authentic community engagement. Again, engaging communities in a way that they're actually a part of the co-design of any solutions that might occur. Letting communities know what business, climate actions and strategies, investments might actually be. I think sometimes the disconnect is that communities don't actually know what businesses, are doing. And again, that goes into businesses not actually being seen as being a part of community. So really understanding that businesses are actual partners, and then, kind of that two-way street of communication is really important. So businesses sharing what their strategies are, and then, actually inviting community in to be a part of any strategies and any co-design of any solutions will be really important.
Great. And it seems so simple, doesn't it? But it doesn't happen.
No, it
And
can.
yes, curious to know if you had a magic wand that you could wave to accelerate that sort of, integration of businesses seeing themselves as part of communities, communities seeing themselves as part of business. If you had a magic wand, what would be the one thing you would do?
Well, I mean, there's ways to do it. I mean, there's communities or organizations like mine who are there to have those conversations. So we have partnerships with both organizations, or both entities. So we're a part of communities, we're a part of these businesses. We can actually make that connection. We don't have to be there the whole time, but we can certainly make those introductions, make that, kind of be that middle ground for that authentic engagement, and then, totally move out of the way, but make that connection and then step aside and say, you all go at it. So I don't know if it's necessarily magic. I think it's just will and intention. So once that will and intention is there, I think it can absolutely happen. But, it just has to kind of exist. So maybe that's the magic wand, just kind of planting that seed and then
Yes.
Yeah.
Sprinkling that gold dust of possibility.
Indeed.
Brilliant. Thank you, Robyn. I'm now going to turn to our private sector representative in this conversation, which is Sarah. And as Haleon, you've done an awful lot of work in this space, and would just love to know, how have you approached the integration of the climate and health equity agenda within your business?
Yeah, great, thanks. So I guess we started with the kind of why. So as a business, our purpose is to deliver better everyday health with humanity. And as I said at the beginning, from a social impact point of view, our single-minded social impact focuses on health inclusivity. So that made it relatively easy for us as a healthcare company to act on this agenda, because at the end of the day, we want to help more people be better included in everyday health. And at the moment, climate, as per the WHO, is the #1 threat to that. And unfortunately, as Robyn and others have said, it's really impacting vulnerable people first and hardest. So because they tend to be more exposed, more susceptible, and less able to mitigate the impact on their health, whether that's older adults, young people, people with existing health conditions, people living in conditions where they're more susceptible, as Robyn was saying, to when climate events happen. So I think it was very clear that, like, the why and the kind of burning platform, like, why is this important for Haleon to act? And then I guess we then moved on, okay, well, the why is clear, this needs to be a big priority. So what are we going to do was the next bit. And there's really kind of 3 main areas that we focus on. So the first is, clearly you can't act on this agenda unless you get your own house in order first. So you need to be acting to bring your own carbon footprint down, because we all need to be acting to be part of the solution. But as we do that, I think what has really helped being part of the Climate and Health Coalition is to think about, as you bring your carbon footprint down, how can you do that in ways that maximise the joint benefits for climate and health at the same time? Because although often the things you do to bring your carbon footprint down are also good for health, it's not necessarily always the case. So putting that lens of, when we're making a choice, how can we choose an action that's going to really maximise the benefits for both, has helped. And one of the ways we've done that, I saw the Clean Air Fund on the call, is to put that lens of air pollution across our climate plans. And so we've done our air quality inventory, and as we're making decisions around reducing our carbon footprint, we bring that lens into what we're doing, which really helps you make the right choices around how you go about it. I think this second thing we focused on is growing knowledge and understanding. So at all levels and inside and outside Haleon, because the more people understand how climate change is impacting health and how it's exacerbating existing health inequalities, the more it builds the case for action and why urgent action is needed. And then the third thing that we focused on is, okay, so how can we help provide solutions to help mitigate the impact of climate change on health? So what are practical things people could do every day that would reduce their exposure to some of the things that are impacting health? And a good example of that is in respiratory health, where we've put together a program called Actions to Breathe Cleaner that helps people understand their exposure to air pollution and make simple everyday changes that can reduce their exposure to air pollution. So instead of walking to school along the main road, walk 2 roads behind, getting schools to change their practices, in the way that people drop off and pick up, getting people to walk to school, scooter, and so on. And what we found is that those simple everyday actions give people a better understanding, but also agency that there are things that I can do about this that can make a difference now. And we've also seen it really engages people in wanting to take some of those wider actions that we need lots of people to do to reduce their individual carbon footprint and impact on air pollution, which is great. Because I think when you can understand, hey, if we all did this in my school or my community, and you can see the impact that it has on reducing air pollution levels for you, you are then much more motivated to do something about it and not see that this is an enormous problem that I can't do anything about.
Great. And you've already started to tantalize us there with some of the things that you're doing at Haleon. I'd love to hear, what is today your favorite example within Haleon of how you're bringing this agenda to life? And that could be internally, it could be through a brand, but kind of for you, what speaks to this integration coming to life within your organization?
Yeah, so I think one of the things that I'm really excited about is a place-based piece of work that we've been doing for a few years now around our mint supply chain. So about 80% of the world's mint comes from Uttar Pradesh in India. And as a company that makes a lot of toothpaste and digestive health products, mint is a really important ingredient in our products and in the product experience. And that mint supply chain faces quite a lot of challenges. It's smallholder farmers that grow mint in India, and it's just one of the crops that they grow alongside onions, potatoes, other things. But it's an important crop for them because they can grow it in the off season when the other things aren't growing. And it's a cash crop where you can distill it locally on the farm and keep it and use it as a kind of banker if other crops are not available at the time, to help you tide you over in times when your income might not be forthcoming from other crops. So what we've been doing on mint is kind of, I guess because it's a place-based approach, you've got the opportunity to join many things together. And what we've been working on with smallholder farmers and our supplier partners and many experts on the ground is how to reduce the environmental impact of growing mint. So adopting good agricultural practices in the way you manage water, how you fertilize the plants, how you manage pests, moving people to more climate resilient varieties, because Uttar Pradesh is facing a lot of challenges with climate change, with really extreme temperatures and challenges around drought. And then also helping through those good agricultural practices and moving to more resilient varieties, farmers to boost their yields, which is really important given this is a crop that they use as a kind of cash crop to help them manage their income around other things. But we've also been working in the wider community around community health, so doing water, sanitation and hygiene interventions with the local community, and then also running women's empowerment initiatives, particularly around finance, to help people manage their finances better and access things like government grants that they might not know that they're eligible for. So it's a nice example of, because we're taking, there's a lot of impacts happening in one specific area. How can we maximize benefits for health, but also income, and addressing the environmental challenges around mint production at the same time?
Yeah, it's a lovely example of it's a manifesto how to create a climate resilient and healthy supply chain. So just my last question for you, Sarah, before I turn to Emmy. If there are businesses either listening in, because we are recording this, who may have read our report or on the call today, that are wanting to take action at the intersection of climate and health equity, would love to hear your sort of top 2, 3 pieces of advice.
Yeah, I guess I would start by trying to really connect it to your core business strategy. So what does this mean for your company? Where can you really make a difference? And also, how can you deliver win-wins where you're delivering an impact for society and for the communities that you're operating in, but also a benefit to the business? Because the more you can demonstrate that, the more you're going to be able to scale it up. So I think connecting it to your purpose, connecting it to your strategy is really helpful. In Haleon, one of the things that's really helped is make it super tangible for people by connecting it to some of the health conditions that our brands treat. So we've talked about, how we have allergy products, how the allergy season is getting 40 days longer than it used to be, and symptoms are much more intense because of the impact climate change is having on the quantity of pollen you have, the intensity of it. You've got mold, you've got spores, it's all going on with the changes, and that really makes it tangible for people working in specific brands, how this is impacting health. We've done that across pain, across vitamins, mineral and supplements, because we've seen that climate's having a big effect on the nutrient density of food. And that means that lots of the micronutrient deficiencies that exist around the world are getting worse, or impacting more people, because people are more and more not getting the nutrients they need from food. So I think linking it really clearly so that people can find their connection point with it is really helpful. And then the example that we've been able to focus on mint is a really good one, because it shows what it looks like when you can do things kind of 360. And then maybe my other things would just be to kind of get started. It can seem like a really massive agenda to think about, well, what are we going to do at the intersection of climate and health equity? But I would say get started. We started the mint program quite small, at a pilot scale with a number of farmers to see what would work, then scaled it up. Similarly with the Octavin Actions to Breathe Cleaner, we started small, got bigger. So I would say, where it's very clear where you can act, I would kind of get started, learn and scale. And then the final thing would be, we all know we kind of go much further together than alone. So we've worked with a number of partners who are really expert in the different areas that we're trying to work in, whether that's, climate resilient mint varieties in India, or how to put together a good schools program that's going to engage primary school children, working with great partners who can help bring that expertise and the resources you need. It is really helpful. And then I think measuring and sharing is important. So, you kind of treasure what you measure, and you learn what works by measuring the impacts. And that's helped us in those areas where we piloted to kind of learn what works and then scale.
Thank you very much. And thank you, Emmy, for waiting so patiently. I'd now like to So we're back to the healthcare sector in particular, which is where a lot of the attention on climate and health started. Just tell us a bit more about the opportunities for the healthcare sector to take action on this agenda and share some examples if you wouldn't mind.
Sure, of course, Sally. Thank you. It was great to hear from Robyn and Sarah as well. I'll focus maybe on one opportunity, one example might be the way to frame it. So the first would be there's really opportunities for action in the healthcare sector at the highest levels of leadership, at the board and C-suite level. I'll give you a little data to back this up, which is through our Practice Green Health data program that happens annually. We learned that almost half of our healthcare partners reported that their CEO and/or their board has identified climate change as a business risk that requires regular reporting. And that's an increase. That number has gone up over time. It was about 40% last year, and again, about 50% this year. So it's not 100%. We'd love to see that continue to increase. But what that shows, me at least, is that there's really an increase in attention at the leadership level to pay attention to climate risk and this intersection of climate and health that is sort of emerging within the healthcare sector. And how that translates into action is that we're seeing more and more organizations in the healthcare sector set these goals and these targets and make progress towards achieving them in order to account for climate change as that business risk. So we see nearly 3/4 of our healthcare partners that we work with have made some kind of a greenhouse gas emissions reduction goal or a renewable energy goal, and they're continuing that work. So the work is continuing. There's opportunity for action at the leadership level, which is really exciting because we know that that's how you get things to move, right? Is when leadership is paying attention to something as a risk and wanting an action plan to address it and requiring or requesting regular reporting. So that's the first opportunity is what's happening at the leadership level. And then one example that I would give is really, and there's many examples that fall into this kind of innovative action within the healthcare sector at the intersection of climate and health. The one that I'd focus on is a bit of a preview. There's a great case study on this in the new report, and that is the work at Boston Medical Center that is happening with their Clean Power Prescription program. So this a pilot program that is designed to address energy insecurity as a climate justice issue. And what the program does is through virtual net metering, it's facilitated by their partner Eversource, and then by a SMART program that's run by the Massachusetts State Department of Energy Resources. Boston Medical Center is actually allocating energy credits coming from their solar array to individual patient homes. So that directly reduces patients' electricity bills by an average of $50 each month. And that's huge. That's a health equity solution because when patients can't afford the cost of running their air conditioner, Robyn touched a little bit on some of these social determinants of health, those patients are exposed to extreme heat, or they might underuse their treatments like a breathing assistance machines or refrigerated medications or nebulizers that rely on electricity. So Boston Medical Center's Clean Power Prescription program is really at this intersection of, how are we not only transforming the energy that the health center itself uses to be clean energy, but then how are we also engaging community members and sort of passing on some of the benefits of that energy transition onto the patients who are energy insecure that they're treating. So that's a great example of action that's at that intersection.
I love that. When I first read the report, that was the example that really leaped out to me because it's what Sarah was saying, it's a win-win, right? So the installation itself is decarbonizing, but it's also enabling access to energy for its community. So I think that's just a really great example. And then Emmy, if I may, so that's shining a light on what's working and what's going well. Where do you see the existing gaps then in the healthcare sector where we still need to see some urgent action?
Yeah, it's a great question. I'd focus on two areas. Again, there's lots of places for optimism, lots of places for areas of action, but let me just focus on two. The first I would say is actually where I put my public health hat on, and it's a more existential challenge in the healthcare sector, which is that we really need to urgently shift our healthcare system away from being a sick care system towards truly living a mission, the mission that the healthcare sector has, which is a healing mission. That's the sector's purpose for existing. And so we know that the best care for patients and for our planet is actually the care that isn't even needed in the first place. And let me explain what I mean by that, which is that the more our healthcare sector and other systems that are within, communities or at other levels of kind of systems, if we're able to go upstream, invest in keeping people healthy in the first place, address those determinants of health, those aspects of each of our lives that shape our health outside of the doctor's office, the better our world will be, right? The healthier we will be, the healthier we will be treating our planet. So we really need action that is towards care that is of that higher value that keeps people healthy in this way. And I won't go too wonky with what that looks like, but there are some really interesting policy solutions, really interesting healthcare insurance solutions. That's an area that we're trying to explore more, is current part of the healthcare sector, and then just creative opportunities to shift care that would increase the value of care provided to patients in this country and incentivize keeping those people healthy. And I will say, I see all of the health professionals we work with are really motivated around this, trying to find opportunities for better care, for preventative care. Hospitals like Boston Medical Center are creating these programs that are designed to keep people healthy by ensuring they have access to energy or to food, and really creating opportunities for this intersection of healthcare and public health, also with climate. So that's one area where I think we need more urgent attention and action, and also just creative thinking for, what new systems can we have that will really keep people healthier. And then the second area, which I think Sarah spoke a little bit about this, is really the supply chain in the healthcare sector. We heard about the example with Baxter. There's very kind of convoluted supply chains with a lot of consolidation at certain levels and kind of reliance on single products or single suppliers for certain products. And so I think really looking at the healthcare supply chain, where are places that we can get really creative to bring, again, greater value to patients. There's also a lot of potential for cost savings there. So that's one of the places where we encourage healthcare organizations to focus, because you can not only address climate and address health equity, but oftentimes, not always, but often you can also bring cost savings to your institution. So supply chain is one of those balls of wax that we're needing to kind of have some more creative thinking and innovation.
Great, thank you. I did promise Q&A, but I've also realized I've not been brilliant at my timekeeping either. But I'm just going to pause to see if there's anybody online that wants to come off mute and ask a real quick question to you amazing trio of ladies. I'll just do a pause for dramatic effect, and there's nothing in the chat. I think it's always harder to foster open Q&A on a webinar, I find. So if there are no questions, then I have been listening really, really hard, and I would like to summarize all your wisdom and inspiration and ideas into 6 ways in which businesses can begin to integrate health equity and climate resilience. And some of this works better than others, I've got to say, because I've made it spell equity, which has got some funny letters in it. But okay, so here are my kind of 6 top tips for integrating health equity and climate resilience. The first, we heard this right up top from Ksenia, but has been echoed, is E is for equipping employees, communities, providers with the knowledge and tools to understand and respond to climate and to health equity issues. And more latterly, thank you, Emmy, equip leadership teams with that knowledge and with that capability to really drive change. Q was really hard. The best I could do with Q is to query separateness. So in other words, and Robyn, this is your point, a business is part of the community. Health is linked to our climate, and just query this separateness. In other words, see the world as more of an integrated whole. That was the best I could do with a Q. Couldn't figure out how to get in a queen or anything. So anyway, that's Q. U is for understand place-based impacts. Sarah, your example of Uttar Pradesh is a really brilliant sort of nod to that. But we understand place-based impacts. We can develop specific responses, specific plans, and get that specific contextual response. I is for integrity, the honesty and the authenticity in terms of how we communicate on this gender, particularly private sector actors where there might be a trust deficit with communities. T, thank you, Sarah, was target wins. So how might approaches deliver value for the business, which then allows you to continue to invest, but critically value for society? And can your purpose be the way in which you sort of understand those win-wins? And why was also really hard. So I've cheated a bit with why. Why is yes. In a world that's full of no's right now, why is yes? And it's yes, let's get started. Yes, test new ideas like the clean power prescription. That is totally genius. And yes to systems change, because actually what we really need to see is the goal of a health system which keeps people well rather than fixes them when they're poorly. So that is 6 top tips. They do spell equity. I did cheat a little bit, but they are some of the insights that I've heard from this conversation. So thank you very much. So equip employees, query separateness, understand place-based impact, integrity, targeting win-wins, and yes, big fat yeses all round. So all that remains me to do in the last dying minute of this conversation is just to say thank you, ladies, for joining us on this call. You've really done a brilliant job at kind of, elevating the report. And I know, Emmy, you contributed some of the case studies and others, and just so thank you for that. Thank you for Ksenia for taking us through the report, and also for the wider forum team. We're always looking for more case studies. We love producing guidance at Forum. So if you've got case studies you want to to be included, then let us know. We also are always growing the coalition. So if you're involved in climate health, then do stay in touch, sign up to our newsletter. But we're just getting started with this. And we think that climate health offers huge opportunity for positive impacts in all sorts of different ways. So just thank you, stay connected. If you've got a great case study you'd like us to feature, let us know. I think that was all I was supposed to do. And we've got no time at all left. So at the top of the hour, I can joyfully say thank you very much indeed. Really appreciate your time. We did record this. And I'm happy to say I don't think it's anything we feel embarrassed about sharing, but we will be following up. And please just stay connected to us in the coalition. And we appreciate your time. Thank you all very much indeed.
Thank you.
Thanks, everyone.